Good morning, folks, and happy Friday. Thank you so much for joining us for Advocates for Ohio's Future, a final budget webinar, our review, our roundup of all the fun we've had over the past 6 months here with the state operating budget. I want to thank you before we get started for following along with us again over the last few months. It's been a really interesting, wild ride. To say the least, lots of good things, some interesting things, and things to kind of maybe reconsider. Moving into this second part of the year, and then moving into the second year of the General Assembly here at the State House. A couple just quick reminders before we begin. This webinar is being recorded and will be available on our website at www.advocatesforOhio.org/webinars. Later this afternoon, we will also be sharing the full slide deck from all of our presenters on our website as well. So be sure to check those out on our website after. I'm really excited about our lineup today. We have some wonderful and amazing AOF experts with us to tell us about what just happened in that budget. We know it's a lot to take in at once, but I'm really excited for them to share what's in, what's out, and what we can look forward to. So just a quick roundup of really what happened a few weeks ago. Time has flown since that deadline of June 30th, but we did have conference committee last time we spoke. Our last webinar was on June 28th, that Monday. Conference happened a little bit later that afternoon, and then votes in the House and Senate. There was no waiting. Things moved very, very quickly after that. Those conference committee members are up on the screen just for your quick reminder. And very, very brief before we move into our speakers here, just a quick rundown of AOF's priorities and how they turned out in the budget using a stoplight method, green for good, yellow for things to consider, and then red for not so great. We're excited to see eligibility for postpartum mothers for Medicaid continue to be included in the budget, as well as increased eligibility for publicly funded childcare, as well as JFS's participation in the ATSAT program. I know our speakers are going to talk to you a lot more about this, so forgive my very brief review. We did have a number of wins also in the conference committee for asking things to be fully removed from that budget. So those things that were be removed, we will be kind of preparing for. We have a feeling, since there was interest in the General Assembly to have these provisions passed, we assume that they will be coming later in the General Assembly through a standalone bill or through some other kind of avenue. So we will be keeping our eye on these provisions to see if they pop up in other bills later down the road. But again, we had some good things removed, some things that will be further explained, as particularly that yellow item, step up to quality ratings. And then we did have a couple items that we were asking the governor to veto that were not vetoed and remain in the bill. And we are continuing conversations with stakeholders and others to make sure that there's a path forward and seeing how we can kind of support the next steps pertaining to those items. And then kind of lastly, two more mostly good provisions added, specifically for broadband. We saw a big increase from $0 for broadband infrastructure up to $250 million by the time that bill was passed. And then the school funding formula was all over the place, lots of changes throughout the whole budget process. Mostly the House version, and a lot of our advocates were supporting remain in the bill, but there was a lot of kind of voucher expansion language added as well. So we'll continue to keep our eye on it, and funding for that program is a little bit up in the air, given that it was supposed to take 6 years to be fully funded and fully locked in, and unfortunately funding for that was only allocated for 2 years. So we'll see how that works out later down the road. And just wanted to share what a journey this has been for Advocates for Ohio's Future and all of our partners on the call. And without any further ado, I would like to introduce our first speaker. Zach Schiller with Policy Matters Ohio is going to talk to us about what happened with revenue, taxes, all the good stuff. Zach, when you're ready, please take it away.
Great. Well, thanks so much, Kelsey, for the opportunity to talk. And I'm going to give you a blizzard of numbers, so just bear with me. Just to review what the General Assembly passed when it came to taxes, they wound up with a 3% across the board rate reduction They increased the threshold at which you start paying the income tax from $22,150 to $25,000. They eliminated the top bracket of the income tax, and that means that now people will pay a higher rate on income only over $110,650 instead of the previous $221,000 and such. So it means that that top bracket no longer exists. It also means lower rates on income over that 221,000. So that's dropping from about 4.8 to just under 4%. These may not seem like very large numbers, but the fact is that they're quite significant. If you're a millionaire in Ohio with only non-business income, you got something like a $6,700 tax cut just from those two things, from the elimination of that top bracket and that reduction in rates, because basically the reduction in rates for people making over 110,000 was a lot bigger than the 3% that most people are getting. The top rate that's been eliminated was first created under Governor George Voinovich in 1992. So this was not a partisan thing at the time. I think really the critical point in all of this is, what does it mean for revenue? And basically what these income tax cuts mean is that we're going to have $1.7 billion less in revenue over the biennium than we otherwise would have. 1.64 billion of that is from the General Revenue Fund. 60 million would have gone to local governments and public libraries, which just incidentally, you may recall the big push by the public libraries to retain the slightly higher amount that they'd been getting in the last budget. A lot of that is wiped out by these tax cuts. But $1.64 billion, that's a lot of money. I think everyone on this call has their own priorities, has their own areas that they're especially interested in, which we'll be hearing a lot more about. But whether it's funding childcare appropriately at 200% of the federal poverty level, whether it's full funding of the Fair School Funding Plan, whether it's reducing college tuition, investing more in broadband, adult protective services, food aid, you name it. I mean, every one of these things could have gotten more support, but for the spending of $1.7 billion over this biennium, and that will continue into future bienniums. So we're going to see a loss of revenue of $700 or $800 million a year going forward on a per basis because of this. Who's getting it? Well, more than a third of it goes to the top 1% making more than $550,000 a year. Another 22% goes to the next 4%, people making over $228,000. So basically that means that well over half of this is going to people making well over $200,000 a year. The average tax cut for someone in the top 1% is $5,400. The bottom 80%, everyone making below $107,000 on average gets a $43 cut. So essentially, in the poorest Ohioans, people making less than $22,000 a year get nothing at all. I think we and advocates for a long time have supported a refundable earned income tax credit. That's not unfortunately included. But I think that the effect of these tax cuts will be felt for years to come. And in particular, the next time that we have a recession, we're not going to have that revenue available. Just one other element that I want to go over briefly, which is there were also many, many tax breaks that were either created or expanded in this budget, ranging from selling a business, the capital gains you get from that, venture capital operating companies, a whole set of education-related tax credits for homeschooling, cash donations to scholarship granting organizations, private school tuition, and many more. One of the most, one that's gotten a lot of attention over years is they reinstated the sales tax exemption for investment coins. Some of you may remember that from the Tom Noe scandal of 2006. By far the biggest is that when a company hires a temp services firm, they'll no longer pay sales tax. That's going to cost us almost $300 million over the biennium. And in a slap in the face to Ohioans who want transparency in government and some accountability for the $9 billion in tax breaks that we have, they eliminated the Tax Expenditure Review Committee. That's the committee that was supposed to review all the tax breaks over an 8-year period. That has now been tossed out, so there will be no such review. The cost of the tax breaks that were included in this budget is over $400 million. in the budget. So altogether, between the tax breaks and the income tax cuts, we're seeing over $2 billion removed in revenue that could have gone to all of the things that AOF wants to see. So I think that pretty much wraps up my presentation. Thanks so much.
Zach, thank you so much. $2 billion. That's we have some ideas where that could have gone for sure. And I'm sure our next presenter, Loren Anthes from the Center for Community Solutions, also has some ideas. Loren, whenever you are ready, you are up.
Thank you very much. And hello, everyone. And thank you, Kelsey, for inviting me here today. And thank you, Zach, for the revenue side of things. Medicaid is well known for the spending side of things in the state budget, though, I think it's pretty well known that most of that comes from the federal government. And given the last year in particular, I think Medicaid has played an incredible role in our state government's response to the pandemic, and will continue to. And it was a rocky ride throughout the budget. So I just want to highlight some of the major pieces. If you need any information, or if you have any follow-up that you would like to go through, you can always email me. And then, of course, we always put out content on this and other issues online and then through our newsletter. So the first thing I want to highlight here is essentially what had happened with the overall spending. What's important to understand with the Medicaid program, if you look at fiscal years 20 through 23, is the great variability in the billions of dollars year to year, but really the outsized role that the federal spending represents. If you look at the red, I included the percentage of the federal resources that actually comprise the Medicaid budget. We often hear that Medicaid is the Pac-Man of the state budget. Really, 4 out of $5 we spend come from either the federal government or from fees assessed to providers like nursing facilities and hospitals. And during this last year, much of how the Medicaid program had been financed was tied to the enhanced federal funding associated with the relief packages passed by Congress. Right now, they're set to expire at the end of the calendar year, but you can see between 20 and 21 how they played an outsized role. 22 assumes essentially that this is going to go away. And then 23, we have a number of programs coming online, additional spending that may happen. And I think the important thing to understand here is that a lot of the management that took place last year when the pandemic was first sort of roaring through last summer, that additional federal spending really enabled the state to stay whole to the tune of $106 million of displaced state funding through federal funding tied to the program. So we're going to see an increase in spending, but a lot of that is either tied to, and this is the message, either tied to the relief dollars that are coming through or through some of the major programmatic initiatives that we're going to see, including disenrollment. We're going to see less people on the program, most likely, because there's been a maintenance of effort to keep people on the program. Utilization patterns have changed. People hadn't been seeking care to the frequency or amount that we had experienced in previous years. This is particularly problematic in certain areas like substance use disorder, where we've seen now that there is a tremendous amount of increase in opioid-related deaths in the United States, and Ohio is, I think, 4th in the nation in regards to that increase. And then also children's health. A lot of the well child stuff, vaccinations and the like, a lot of children were not making those appointments, and many individuals were not making the appointments because services weren't necessarily readily available, which is a consequence of essentially spread. Next slide, please. So some of the main budget issues that I just want to highlight here, I know Kelsey had mentioned this, postpartum coverage up to 12 months, $46 million over the biennium. This is a very significant policy change. I know that many who are participating on this call had been pushing for this change for a long time. The American Rescue Plan Act had a provision that enabled states to do this more simply, and Ohio took advantage of it. So, while functionally we sort of had this in place because of that eligibility maintenance that is already in place with the program, this will enable it to continue for women who had just delivered, where the previous standard had been only 60 days. I think the caveat I would highlight here is that it's really important that we collect data and information about access to services, coverage, and the benefits associated with it, particularly for maternal and infant health outcomes, something that my colleague Hope Lane had recently illuminated me to. And we will be tracking this information and tracking other maternal and infant health issues long term, but this is a major step forward for the state of Ohio. Also, a major step forward was the protection of Ohio's procurement process. While it's wonky, I'll put it this way: the majority of the Medicaid program is really about delivering services as an insurance product, and the majority of how that gets delivered for most Ohioans is through Medicaid managed care. And Ohio has not performed well historically, or it's performed average or below average. And this procurement process was really a set of policy initiatives seeking to increase value, to make things more administratively simple, and create more accountability in parts of the program like pharmacy, where we saw some pretty egregious pricing issues take place. One particular plan was not happy with the state's process, still not happy. Paramount is currently bringing a lawsuit to the state of Ohio regarding that process, but that's to be expected. The good news is that the revised code didn't have any language which would have created a certain amount of market exclusivity in our state, and really interrupted all the other programmatic activities of the state with procurement, including Ohio Rise, which is our response to the issues around multi-system youth. And I'm sure that Tim is going to touch on this, but one thing that was maintained that was curiously eliminated one portion of the budget was the Children's Health Insurance Program, Medicaid program, programmatic funding for lead abatement. Also, and if I could get through this in just a few seconds, I think I would get an award, but there was a tremendous amount of movement in nursing facility reform. Nursing facilities are the largest cost center in Ohio's Medicaid program, and they are unique in that they are the only provider type to have their rates established in Ohio Revised Code. While there was a tremendous amount of movement, a few things that I want to highlight was there was additional money for quality payments, and also maintain the Quality Payment Commission, but it's mainly guided by the General Assembly, and the General Assembly is tasked with looking at the executive's proposal regarding the bed buyback program. The rebasing, which would have added a tremendous amount of money to the budget, and still does to the tune of $250 million, mandates that 70% of the rebasing money goes to staffing, which is, I think, an important development, if only because it means in a state like Ohio, where the average nursing facility direct care worker makes $11 an hour, it could provide some continuity of care, could improve services, because we often see that staffing quality, staffing training, and payment are related to quality issues. And then also maintain the specialty focused facility program, which sought to address major issues of systemic quality when it came to our delivery system and institutional long-term care. Next slide, please. So a couple other things just to highlight for you, some concerns. So it's maybe some of the yellow items. More ODM oversight. So there's a requirement now that the director testify to the Joint Medicaid Oversight Committee on rate increases of over 10%. There's going to be a franchise permit fee report, which gets to supplemental payments to hospitals in particular. Greater controlling board oversight regarding transfers of funding. So where the director had the ability to request from OBM, they have to go to the controlling board. Also, and this is a provision to really pay attention to, we have as many people in the Medicaid program here to date in part because of the COVID response, and the challenges that when the public health emergency ends, how do we manage all the people who are on the program? The General Assembly basically is going to put pressure on the state to do this much more quickly, and that's going to be a big concern for people when it comes to due process rights and maintaining eligibility. And to just sort of like wrap up here pretty quickly, the work requirement waiver is now more voluntary. That wasn't changed during the budget. There's this Medicaid cost assurance pilot program, which seems like a sort of a provision that was a giveaway to a particular startup based in Columbus. And then the Rescue Act highlighted some home and community-based service enhanced funding. I'm sure that Beth Kowalczyk will review that. So happy to answer questions as needed, and I'll be happy to turn it over to my friend and colleague, Tim Johnson. Thank you.
All right, thank you so much, and good morning, everyone. I'm here to talk today about the lead poisoning prevention provisions in the state budget. And I would like to start out by, of course, mentioning that lead is a deadly neurotoxin for which there is no cure. Lead poisoning can lead to cognitive delays in kids, can lead to behavioral health problems and developmental issues. Children who are lead poisoned are less likely to be ready for kindergarten, more likely to encounter the juvenile justice system, and more likely to be incarcerated as an adult. And there is no safe level of lead in someone's blood. So thank you for the opportunity. Thank you, AOF, for allowing me to present this morning. First, I'm going to go over some of the provisions that got into the budget, and then I'm going to talk about the things that were left out. So the first thing that got in was the lead abatement line item was increased to $6.5 million in each fiscal year. It was previously $150,000 in each fiscal year, so it is a significant increase. The main reason for this is because there is a first of its kind state lead safe housing fund that's being established. And this will allow grants for up to 9 communities around the state to advance primary prevention strategies in their communities. And so we're very excited to see this. This is something that lead advocates have been asking for a long time. We have heard that there are communities that want to do more than what they're currently doing for lead poisoning prevention efforts, communities that aren't doing a lot at all, that is just looking for some sort of funding to help them get going. This is a historic investment. I can't think of sort of any other investment of this type being made by the state, at least in recent memory. And so we're thrilled that the governor chose to include this in his as introduced version of the budget. And then that funding was maintained throughout the entirety of the state budget process. So very, very excited about that. We know that ODH is working very hard right now on the details of that program to get it up and ready to go. So hopefully we'll be hearing more information about that soon. I know they want to get the program up and running and get the money out the door as quickly as possible. So we're very excited about that. Something else that got into the budget, and my colleague just touched on this, was the S-chip lead abatement program for high-risk kids. This program essentially allows for the removal of lead hazards built in homes that were built before 1978. It's for children who are under the age of 6 or for pregnant women. S-chip is really the state's best current primary prevention program. And if folks don't understand what primary prevention is, it's the strategy of getting to children before they're lead poisoned in the first place. The way it works now is that if a child goes to their doctor and is found to have elevated levels of lead in their blood, an investigation is done to figure out where the poisoning might have occurred, and then a lead hazard control order is issued once that lead hazard has been identified, and there's a certain time limit by which you have to remediate that lead hazard. But all that only occurs once a child has been lead poisoned. So we want to move to a place where we're remediating lead hazards before someone ever gets poisoned. And the S-chip program allows for that. It funds the remediation of homes that have identified lead hazards because a child's been poisoned, but also looks at homes in high-risk areas and targets those where there may be lead hazards regardless of if the child has been poisoned. And the S-chip program had a bit of a rocky road in the budget, as Loren sort of alluded to. It was in the governor's version and in the House passed version, but briefly, for some reason, it was removed in the Senate substitute version of the bill. Certainly want to take this time to thank all of the advocates, the staffers and lawmakers who understood the importance of the S-chip program, how many families and children it's helped over the few years that it's been in existence, and made sure that that program was restored in the omnibus amendment. So we're very excited. It's 10 million. It is 10 million over the biennium, 5 million in each fiscal year, and we're very excited that that was maintained and included in the budget. There was also funding for some local initiatives that had been previously in the budget that were maintained. Specifically, there is funding for Cleveland at $1 million in each fiscal year. Cleveland right now is doing a lot of great work on their lead safe initiatives, specifically their lead passed ordinances. And they had received $1 million in the previous biennium, and that was maintained in this budget. We're very happy to see that. The city of Toledo is also doing a lot of great work in Northwest Ohio with their own lead ordinance, and they had $150,000 in each fiscal year in the previous biennium, and that was increased significantly to $500,000 in each fiscal year in this current budget. So we're very happy to see sort of Northwest and Northeast Ohio leading the way locally, and we're happy that the state is choosing to continue to support them in their lead poisoning prevention efforts. We're very happy to see that. And then lastly, we're happy to see the EI early intervention funding maintained, because a portion of that also goes for resources for families whose kids have been lead poisoned. So I'm certainly grateful to the General Assembly for maintaining that. However, there are a few things that were left out of the budget, unfortunately. The ability for the health director to issue fines for folks who are in violation of Ohio's lead abatement laws was removed in the House passed version of the budget. That recommendation came from the governor's lead advisory task force report, because currently, if somebody violates the law, the only rule tool the Department of Health has is the suspension or revocations of a license. And unfortunately, there are not a lot of people doing sort of lead abatement work in the state of Ohio. It's a very small workforce, and it doesn't make a lot of sense to shrink what is already a tiny pool of workers. So allowing for the director to be able to issue a fine means that, you know, people who don't follow the law can still be reprimanded, but still allows them to continue the work without shrinking that pool. Unfortunately, that provision was removed in the House substitute version of the bill, and or at any other version. There was also funding that was removed from the Ohio EPA as part of the H2 Ohio initiative. There was $46 million in each fiscal year that was going for water and sewer improvements, which included funding for lead service line replacements. Ohio has quite a bit of lead service line in the state of Ohio. There was a report yesterday, actually, that came out from the National Resource Defense Council that states that Ohio has the second most lead service lines in the nation at 650,000. We're second only to Illinois. So that is a significant number. And we were excited to see that funding being put forth to address a serious issue. Everybody deserves to know that clean, lead-free water is coming into their home. But unfortunately, the House reduced that amount to just $10 million in each fiscal year. And that original appropriation was not restored at any point in the budget. However, on a good note, House Bill 168 did allocate $250 million for a water and sewer quality program. And we are very hopeful that that money can also be used for the replacement of lead service lines. So, and then lastly, the ability to make Ohio a state that runs its own renovation, repair, and painting program was removed from the budget. So the renovation, repair, and painting program, also known as RRP, was something implemented as a rule from the US EPA back in 2010, which essentially requires that contractors who perform any sort of renovation, repair, or painting work in a home built before 1978 be certified to do so in a lead safe manner. So that's already the rule. All contractors in the state of Ohio are supposed to be doing that. The reason being because renovation, repair, and painting work stirs up lead dust and stirs up lead paint chips, which are the #1 way children end up lead poisoned, by inhaling lead dust or ingesting lead paint chips. And usually the US EPA handles the enforcement, but allows for each state to handle its own enforcement if they choose to. And the reason that that's a good thing to do is because the US EPA enforcement tends to be haphazard. So sometimes they're doing it, sometimes they're not, which is not great for kids. And when they do it, they're overly punitive. So they can issue some very significant and harsh fines that can be very bad for the businesses who are in violation of the rule. ODH has a great track record working with lead contractors already, getting them certified. And so ODH was very equipped to take on and handle this responsibility. But unfortunately, despite being in the House and the introduced version of the budget, it was removed in the Senate and was not restored in conference committee, though I will thank all the staffers and again, lawmakers who stepped up and advocated and tried to get that put back into the budget. And the $650,000 that was associated each fiscal year with that program for startup funds was also removed. So we are disappointed to see that those aspects did not make it in, but we are looking at other avenues for how we might be able to do that in the future. So thank you very much, everyone, and I will go ahead and I will let Beth take over.
All right, thank you. I'm talking about the aging and HCBS developments in the state budget, and I have to say that there was some good news on this front. We have been advocating for years to get more support for older adults and on the home and community-based side of the long-term care continuum. It continues to be out of balance. Home and community-based services, both within Medicaid and outside of Medicaid, are not keeping up with the need and our growing older adult population. We're all aging, we're aging longer, and we all want to stay at home as long as possible. And so that has been our mantra for years. And in this budget, we do see some good improvements and investments in that area. And I love showing this slide, which shows the various costs per month, ranging from local aging services, which are non-Medicaid funded services, costing about $66.99 per month. Home and community-based services, the Passport Over 60 waiver program, $1,200 per month. And then looking at the institutional care, with the cost as much as $6,000 per month. So it's where people want to be. It's the most cost-effective option, and we should really be investing on this side of the spectrum as well, so that we are a balanced continuum of care. So our first priority in the Aging Network was looking at the non-Medicaid side of the spectrum and looking at funding the Senior Community Services GRF line item to provide services such as meals, transportation, home modifications, and other services through the area agencies on aging. And we were seeking funding up to $1.2 million per year to bring our this line item up from, over 20 years, it's been cut significantly. So at least getting it to a midpoint range of $10 million per year. And at the very end of the budget process, we were ecstatic to see that in conference committee, an amendment was introduced to add $1 million per year in this line item to support these services. And so that will make a tremendous impact in the non-Medicaid side of home and community-based services. There were some other things in the Department of Aging's budget that were in, and some things that were introduced and then removed. There's a technology pilot program that will provide grants for remote monitoring technologies to help older adults having them be able to monitor their health within their homes and in facilities through these different technologies. There were two things that are not in the ultimate version of the budget. One was a new line item that the Department of Aging had proposed called statewide aging initiatives, and that was intended to fund implementation of the strategic action plan on aging, which is a very developed document regarding how to address several types of outcomes related to aging in the state. That was introduced but was removed ultimately through the budget process. Additionally, introduced during the budget was the expansion of the Program of All-Inclusive Care for the Elderly, or PACE, which is an alternative model for serving the dual Medicaid, Medicare population. It's currently a program in Cleveland, and the language would have required expansion into a number of areas. That was removed ultimately, but I believe there will be continued discussions about exploring that option. On the Medicaid side of home and community-based services, this was something that across populations and programs, organizations, advocates, individuals were all saying has to be addressed. In our world, the area agencies on aging have done a couple of surveys, and the last survey was of the consumers in our programs to understand whether their needs were being met. And we found that almost 3,000 individuals who were enrolled in home and community-based programs were unable to get personal care because of the shortage in the direct care workforce, which primarily is because of wages and low reimbursement rates in Medicaid. And so this has become a crisis issue, and we have been advocating for change for years. And unlike nursing homes, these rates are not in statute. And so the only way to get an increase is appealing to the administration or going through the General Assembly. And we advocated for a 5% increase in each year of the biennium for these rates, and to be looking at how we can bring the system into balance with nursing home rate review. What we eventually accomplished was an increase in rates. It wasn't 5 and 5%, but it was based on the Department of Medicaid having introduced an initial 4% increase in the first year. We were able to secure another 2% in the second year for home care and assisted living, as well as funding for adult day services. What's unusual about this is that while the appropriation for these rate increases remains in the budget, the governor vetoed the temporary law language, which would delineate where the funding would go and how the rate increases would occur. But the veto message from the governor indicated that the preference was to implement this by administrative rule as opposed to statute. And there was a commitment to do rate increases. My colleague Loren covered the nursing homes, so I won't do that, and he did a terrific job. For developmental disabilities, there were a couple things. The most notable was a similar situation where there was a rate increase for adult day and residential services that was proposed, put in language, and then vetoed in terms of language, but the appropriation is there. And then a few other things of note. Adult protective services, this was a big deal. $1.5 million were added per year to the state APS line item. This is the only dedicated source of funding for adult protective services in the state of Ohio. And it raised the amount to $5.7 million per year, which will be distributed to the counties in the amount of $65,000 per county each year. That amounts to one caseworker per county. And for many counties, this is really a boost, I think, in terms of funding. And I think this is the most that APS has ever seen in terms of the funding of that line item. Added to the budget as well, and I think this was briefly mentioned, was the requirement for ODJFS to apply to USDA to operate an elderly simplified application project for SNAP, which will streamline and make it easier for older adults to apply for SNAP. And then finally, the Department of Health now has the requirement to license home care providers and independent providers, which is something, and it cuts across all home care. The Department of Medicaid and Department of Aging and Department of Developmental Disabilities certify providers to be able to provide services and receive reimbursement under their programs, but there's no broad-based licensure of home care providers. And so this would include private pay. There are exceptions for the providers who are currently in different types of state-funded programs or federally funded programs, so that the process isn't too onerous for them. Including with the Department of Aging, those providers, if you go through the aging certification process, you will be automatically able to get a license through the Department of Health without going through any additional requirements. And then this was also mentioned as far as what's not in the bill pertinent to older adults, as well as just affordable housing in general, is that language that had been introduced during the process would have required valuing subsidized and low-income tax credit housing at market rent without taking into account the lower rental rates for property tax purposes, which would really cause a problem in terms of enabling new affordable housing and operating existing affordable housing units. And housing is a significant problem for older adults as well as, you know, the broader population. So that's all I have. I'm going to stop sharing my screen and I will turn it over to whomever's next.
All right, well, we get our screen up for Hope. You are next. You are welcome to get started. Your screen will be up in just one moment.
Awesome, thanks, Kelsey. My name is Hope Lane. I'm a policy associate with the Center for Community Solutions, and I will be presenting on SNAP in the state budget today.
Technical difficulty, continue going. Oh, but yeah, just a moment.
Awesome, thanks, Kelsey. Yeah, so the governor's introduced budget had very little mention of SNAP actually, and no programmatic SNAP changes. Actually, the governor's budget, the only significant mention of SNAP was to ensure that the phrases SNAP and food stamps were synonymous with each other. So that was the only mention of SNAP in the governor's budget. SNAP stands for the Supplemental Nutrition Assistance Program. Other common previous names include food stamps, electronic benefit transfer, nutrition assistance, and food assistance. SNAP is the largest federal nutrition assistance program. The benefits themselves are completely federally funded, but state administered. So this means that states often share in the cost of administering the program. And states also have the autonomy over some eligibility requirements as the test. SNAP in the House passed state budget through a bipartisan effort, as my colleague Beth just mentioned, was able to secure the inclusion of the Elderly and Disabled Simplified Application Project waiver, the EDSAP waiver. This is a waiver option offered by the USDA to reduce agency workloads while simplifying the SNAP enrollment and retention process for the elderly and disabled households facing food insecurity. This waiver is currently in practice in South Carolina and Alabama, in Georgia and Florida, Massachusetts, and more. Why is EDSAP important? Ohio is an aging state. This population represents over a third of Ohio's SNAP caseload. And this population has historically struggled with food insecurity and churn. Churn is being disenrolled from the SNAP program for administrative reasons and not because you're not eligible based on your income. The EDSAP waiver is crucial because it extends the certification period to 36 months for elderly or disabled households with no earned income. It waives the interim reporting requirements and it waives the recertification interview. SNAP in the Senate passed budget, however, included Senate Bill 17. So Senate Bill 17 was introduced in early January 2021 amid a pandemic and recession. It included elimination of broad-based categorical eligibility, reinstatement of asset tests and limits, SNAP EBT photo ID requirements, mandatory child support cooperation enforcement, change reporting, and it also included some concerning Medicaid and unemployment compensation provisions. SNAP, the next slide. SNAP in the Senate passed budget continued, more about Senate Bill 17. So when Senate Bill 17 went through the traditional process, the committee process, it had 3 proponents and it had 60 opponents from advocates and organizations. But regardless of this, most of the bill was rolled into the budget after all public testimony was finished. Following this, advocates and organizations began an intense 11th hour campaign, which included letters, media, and direct outreach to members to get these provisions out in conference committee. So the final budget, what's in, what's out. So EDSAP, as Beth mentioned, remained in. There was a Public Assistance Benefits Accountability Task Force that is in. However, all of those Senate Bill 17 provisions we just discussed were taken out. And that is all I have. I will pass to the next presenter.
Thanks, Hope. And Big thanks to Advocates for Ohio's Future and all the members who are on the call today for your leadership in the state budget. And thanks just to everyone for joining us today, for your engagement and your work on the budget as well. My name is Will Petrik. I'm the budget researcher with Policy Matters Ohio. We believe that all Ohioans, whether Black, white, or brown, deserve to thrive. And I'm here today to talk more about changes in the budget related to childcare. So you can go to the next couple slides, I think, Kelsey. First, I just want to outline and talk about why childcare is critical. So we know that high quality childcare is critical for early childhood development. So children's brains develop fastest from birth to age 3, and their relationships with their parents, with caregivers, and early experiences, both positive and negative, build the foundation of their brain architecture. So this supports their ability to learn, their behavior, and their overall health. So this is why it's so critical to invest and support parents and babies early. And we also know childcare supports moms and families. When parents, particularly moms, have affordable childcare options, they're empowered to get jobs, keep their jobs. And so our vision for the state is, all parents, no matter how much money they make, can have the choice to go to work with the assurance that their kids have a safe, nurturing place to be. There's also been more and more public discussion, particularly with COVID-19, just an increasing recognition that childcare is basic infrastructure for our economy. It helps, again, parents and caregivers stay in the workforce. That's why we call childcare the workforce behind the workforce. Next slide. Before jumping into the budget, I just want to provide a little bit of context about the needs regarding childcare in Ohio. So for decades, Ohio lawmakers haven't devoted the resources necessary to build a bright future for all of our children. Even before COVID-19, thousands of families couldn't afford high quality childcare, and only 26% of Black children started kindergarten ready to learn and grow. This slide highlights that the childcare system is built on a low wage workforce of primarily women and disproportionately Black and brown women. So this slide highlights that women childcare workers make on average just $10.65 an hour. And that's a symptom, again, of an under-resourced childcare system. Next slide. And just a note, long-term, I think it's critical that childcare workers make a living wage. This slide highlights how, even though workers are paid poverty level wages, childcare can still be crushingly expensive for families. So right now in Ohio, a single mother with an infant and a 4-year-old working full-time at $15 an hour makes too much to qualify for publicly funded childcare. She'd have to spend basically over half her income for a high-quality center-based childcare setting for her kids. And that leaves very little to pay for other basics like food, housing, transportation, and healthcare. Next slide. And that in part is why Policy Matters and Advocates for Ohio's Future called on lawmakers to make childcare more affordable by expanding initial eligibility for publicly funded childcare in the state of Ohio up to 200% of the federal poverty level. So what's in the budget? This slide really highlights that there are new investments to support childcare, but they're all federal dollars. So there's no new additional state support. There's 17.6 increase compared to the last 2-year budget in the federal child care line item. That's the Child Care Development Block Grant. There's also a 21.4% increase for child care in the TANF service framework in this 2-year budget compared to the last 2-year budget. Next slide. So what does that mean? I think first, it's important to note that the Ohio Department of Job and Family Services is using some of those additional federal dollars to increase reimbursement rates for child care providers. So as some folks on this call might know, the cost of childcare has increased, and base rates for publicly funded childcare providers have to be increased to at least the 25th percentile of market rates to stay in compliance with the Child Care Development Block Grant requirements. So we are glad to see this rate adjustment for providers, and it's important to recognize that this is still a very low bar. The federal government maintains that setting rates at the 75th percentile ensures equal access. So we could be doing a lot more. One of the things that Kelsey highlighted initially was the budget does increase initial eligibility from 130% up to 142% of the federal poverty level. And that's for the publicly funded child care program, that's subsidized child care. And this will help roughly 6,000 children across the state whose families aren't currently eligible for that support. They'll be able to now afford childcare. The budget also increases initial eligibility up to 150% for children with special needs and families with those kids, up to 150%. And that means an estimated, ODGFS estimated that 100 children will be served in this fiscal year and an additional 220 to 250 children in the next fiscal year. So as we look toward the next budget, we're going to continue to push for increasing initial eligibility up to 200% of the federal poverty level to make sure all families who need childcare can afford it. In terms of what else does this mean in terms of the federal dollars? One, there's a requirement that the Ohio Department of Job and Family Services use additional federal resources to stabilize the childcare system and sustain the childcare system, to retain and develop the childcare workforce, and to make childcare more accessible and affordable. So there's a specific earmark of $50 million from the Consolidated Appropriations Act that those funds be used to provide co-payment assistance for families accessing publicly funded childcare. It's important to note that these are one-time federal stimulus funds, so those will not be ongoing programs. The other big change, and Kelsey highlighted this at the beginning as kind of a yellow area around childcare, is there was a restoration in the budget for the 2020 mandate for publicly funded childcare providers to be 1-star rated in the Step Up to Quality system. So that 1-star rating is maintained. However, the budget does remove the requirement for providers to be 3-star rated by 2025. So that eliminates the mandate for childcare providers across the state to improve quality and be at that 3-star rating by the year 2025. The budget also creates another legislative study committee to evaluate publicly funded childcare and step up to quality. And so the work continues in terms of making sure we're monitoring and weighing in and highlighting to lawmakers and continuing to educate lawmakers about why high quality early education matters for babies, for infants, children, and families. And I think that wraps up my presentation. Thank you again so much to everyone for joining. And I think the next presenter is Susan Jagers with the Ohio Poverty Law Center. Thanks.
Right. Good morning. Thanks, Will. I am Susan Jagers with the Ohio Poverty Law Center, and I'm just going to touch on how legislation in the budget begins to address the digital divide in Ohio and connecting the more than 1 million Ohioans who do not have access to broadband. So just for some context before we get to the specific budget provisions, I want to talk about House Bill 2, which was moving in the General Assembly at the same time as the budget. House Bill 2 established the Ohio Residential Broadband Expansion Grant Program and funded it with $20 million in state fiscal year 21. And that bill was effective on May 17th, 2021. So that's already in effect, the grant program. So just a little more about the specifics of the grant program. On the next slide, Kelsey, The House Bill 2 established the Ohio Broadband Expansion Program Authority, which oversees the grant program and approves the grants. There's 5 members of that authority, including the Director of the Department of Development, the Director of Innovate Ohio, which is the Lieutenant Governor, and 3 appointments, 1 from the House, 1 from the Senate, and 1 appointment by the Governor. To note just a couple of things about this grant program. It defines eligible broadband providers who can apply for grant funding. And it is, the eligible broadband providers are generally private internet service providers. The legislation specifically excludes governmental and quasi-governmental entities from applying for these fundings, this funding stream in the grant program. The legislation also defines eligible projects as providing 2-tier service to residences in unserved areas. And that's defined as service that would be at speeds of 25 megabits per second download and 3 megabits per second upload. So that's the basic eligibility for the grant program. The Department of Development does need to develop rules for this grant program, and I have not seen those rules be released yet for public comment, and appointments have not been made for the authority yet. So although the bill is in effect, the program is not up and running yet. So how does the budget address broadband infrastructure? So the House version of the budget included $190 million for the Broadband Expansion Grant Program. And we were pleased to see that investment. And although we wanted to see some changes to the grant program that would allow government entities to apply for the money, and we would like to see it address affordability, we were happy with that investment in the grant program. Then when House Bill 110 moved to the Senate removed all funding for the grant program. So they zeroed out that $190 million. And in addition, they added more language that would restrict political subdivisions or governmental entities from providing municipal broadband services to their residents. And they restricted that, not related to the grant program, but in general, wanted to work to make sure that municipalities wouldn't be competing against private internet companies and expanding services to their residents outside of unserved areas. With the budget coming out of the Senate, of course, we were very concerned about no funding and then further restrictions on who could provide broadband services. So the final version of the budget from the conference report and what was ultimately enacted is what is on the screen before you. So to our surprise, not only was the $190 million restored, they actually added additional funding. So there is $230 million in fiscal year 2022 for the Broadband Expansion Grant Program and $20 million for fiscal year 2023. In addition, that restrictive language around municipal broadband services was removed. So I think it will be an ongoing discussion in the state as more funding, federal resources and other resources are available for broadband expansion, who will be able to provide those services. So, you know, we still have a lot of work to do to close the digital divide and connect those 1 million Ohioans who don't have access. We still need more resources to get the job done. We need no exclusions on who can provide those internet services. We really need an all hands on deck approach to make sure we can close the digital divide. And of course, infrastructure is only one piece of it. We really need to talk about affordability as we move forward as well, because it's great to have the infrastructure, but if you can't afford it, you still don't have access to the internet. So that is the quick overview of the broadband expansion money in the budget. Thank you. I'll turn it back over to Kelsey.
Susan, thank you so much. And thank you to all of our presenters this morning. I know asking folks to condense comments on their issue area to 5 minutes is tough. And there's a lot that happened in this budget, but a lot to look forward to throughout the rest of this legislative session. I wanted to make sure that we included some resources for you during your own research as you continue to review the as-passed version of the budget. We made sure to include that LSE comparison document, those little brief blurbs about what is in the budget by administrative office or department. So it's really easy to follow through. We also have the appropriation spreadsheet if you want to look at really where those numbers have landed and take a deep dive. We also want to make sure we included a direct link to the governor's veto message and less vetoes, I think, than we've had in past budgets, but they're there for your review. And also wanted to make sure that we linked our kind of review as well, really diving a little bit deeper into the issues that AOF specifically was advocating for and speaking to in the last, especially during the last few days. It was a mad dash to the end. And finally, we do have a couple questions from our audience. So if you would like to enter those in the Q&A or in the chat, I'm going to ask our participants if they have a few minutes to stay on with us. But as always, those resources are there for your review. And I want to thank everyone here and all of our advocates and our panelists today for their advocacy. Again, it has been a wild ride, I think has been the term we've been using here, watching the budget again, and especially a lot of those provisions added in the last minute by the Senate. But we know that those calls, those emails, those letters written, those firsthand accounts of how these issues would impact you or those that you love really made a difference in getting some of those, especially really harmful provisions removed in the last minutes of the budget. So we do have a couple questions, so we will stay on and address them as needed. So feel free, submit them via chat, or we are also welcome to submit them via the Q&A. So we'll stay on. And then I'm going to ask my policy assistant, Sarah, she keeps me straight to help highlight some of those questions as well for us. Let's see, first question. Do you see the Senate Bill 17 provisions coming back? What could or should advocates do to prepare for this if so? So I'm going to give a very brief view on my point, and I'm going to ask my colleague Hope Lane Gavin to tell her thoughts. Yes, Senate Bill 17 is still alive and well in the General Assembly, and we will surely be preparing for some activity on that bill. Hope, please feel free to hop in.
Hi, Sarah. Thanks for the question. My take on it is that we will definitely see something similar in legislature comes back in the fall. Historically, all of the conferences, we call them bill mills, like the ALEC of the world and FGA, and those conservative, again, bill mill groups, they meet in the summer. They have their conferences in the summer. They regroup in the summer. They meet in DC and across the country to get together and figure out what worked in the first half of the year and what didn't work and how to regroup. So I anticipate seeing it again, and I anticipate another fight.
We also anticipate a new bill being introduced in the House probably pretty soon. We know that a SNAP photo ID bill is introduced by Representative Kaler. However, Senate Bill 17, kind of its companion or twin, has not been yet introduced in the House, but we anticipate some of those provisions to pop up over there as well. But we continue to monitor those introduced bills over the summer. All right. Looks like our presenters as well are including email addresses in the chat for you to reach out directly. Really, really thankful for our panelists for doing that and being so open. Let's see, do you have a question or a comment? I see you pop back on. Keisha's here.
I think there's a question in the chat related to the debt settlement companies. Yes, I would just say from the Ohio Poverty Law Center, I think we have concerns about that bill that was introduced We are looking at it, and we'll be working with some other colleagues with concerns on that bill for sure.
Thanks for that, Susan. All right, folks, I do see a couple hands up, so just remember to submit your question via the chat if you have any. We'll give a minute or two, and then we will hop off. I want to thank you again for your time this morning and for your continued support of Advocates for Ohio's Future and for tuning in. We will be back with webinars and other opportunities to advocate and participate when the General Assembly comes back, usually around mid-September is when we'll expect some committee activities to ramp up and to really get back moving. All right, folks, that will conclude our webinar today. I want to thank you again for your time. As always, please feel free to reach out to me or to any of our panelists here in the chat with any specific questions to follow up. The full recording and the slides will be available at advocatesforohiosfuture.org this afternoon, just afternoon. Thank you again for coming on this journey with us. We appreciate you, advocacy, and we will hop off. We did see a question just come in. We will answer that on our website this afternoon. Thanks again, folks. We'll see you again. Have a great rest of your Friday. Have a great weekend. We'll see you later.